You know, in any skilled nursing facility, there's a really direct, unbreakable link between how good your clinical documentation is and your financial health. But here's the thing, the biggest threat to your revenue probably isn't some new regulation. It's hiding right inside your own records. This right here, this just nails it. We spend so much time looking outside for financial risks, but the truth is, our biggest vulnerability is often the story we're telling, or maybe the story we're failing to tell in our patient charts. So how in the world do small gaps in paperwork turn into these massive payment cuts? Well, let's break it down. First up, we've got to see documentation for what it really is. It's not just busy work. It is the clinical story that justifies every single dollar you get from Medicare. And if that story has plot holes, the whole reason for payment just falls apart. And at the absolute heart of that story is this one core concept: medical necessity. This is the standard. It's the benchmark that payers like Medicare use to decide if the services you provided were actually needed. Every single note, every entry, it all has to support this one idea. This brings us to the number one risk. If your documentation doesn't scream, "This care was absolutely necessary and required a skilled professional," you've created what we call a medical necessity gap. And that is the single biggest reason for payment recoupments. Now, in AI Shield, on the other hand, it's like having a constant fact checker looking over everything to make sure that story of necessity is always crystal clear. And this problem just builds on itself. It's not just about one bad note. It's about all the notes agreeing with each other. I mean, when a therapy note says one thing, the MDS assessment says another, and the nursing notes are telling a totally different story, well, that's a huge red flag for an auditor. It just signals chaos. An automated system, though, can catch those contradictions before they ever see the light of day. Oh, and this is a subtle one, but it's absolutely critical. A progress note that just says patient tolerated therapy well is basically useless for reimbursement. Why? Because it doesn't prove a skilled professional had to be there. The documentation has to show the specific skilled things you did, your clinical reasoning, and how the patient is progressing. AI can actually give clinicians a little nudge in real time to add that crucial detail. Okay, so we've talked about the content of the story. Now let's switch gears and look at the process itself. Because even if you have a perfect clinical narrative, simple little procedural mistakes can totally blow up your claims. Time is literally money here. A note that's late or missing or, and this is a big one, backdated, immediately makes an auditor question everything. These are such easy targets, and they can lead to automatic denials, no questions asked. I mean, think about this for a second. You can provide amazing, medically necessary care, document it perfectly, but if you're missing a doctor's signature on an order, that entire service can be denied. It's such a simple, unforced error that costs facilities a fortune. Automated tracking makes these kinds of costed mistakes almost impossible. All right, building on that whole consistency theme, let's drill down into a couple of specific data mismatches that auditors are literally trained to hunt for, because this is where those denials really start to pile up. Therapy minutes, this is a classic. It's one of the most scrutinized things in SNF billing. If your therapist notes say they did 45 minutes of treatment, but the claim bill's for 50, that little discrepancy is going to lead to a direct payment cut. There is zero wiggle room here. Those numbers have to match perfectly. This one really highlights how documentation needs to be a living, breathing thing. The care plan isn't a set it and forget it document. If a patient's getting better, but their care plan still looks like it did on day one, a payer is going to ask, so why are you still providing this level of care? The plan has to evolve with the patient to justify continued payment. So you've got all these little gaps: a missing signature, a mismatched minute, a weak progress note. What does it all lead to? Well, it leads to the day of financial reckoning, the audit. Let's be crystal clear about this. When Medicare comes to claw back money after an audit, it's not usually because of some big, elaborate fraud. It's because the documentation just failed to provide enough proof to support the payments that were already made. The facility just couldn't defend its own story. And the costs? They are staggering. A single audit can easily end up in a recoupment of over $150,000. For most facilities, that's not just a number on a spreadsheet. That's a devastating financial hit that can affect staffing, resources, and yeah, ultimately, patient care. So it's really worth asking yourself this question. If an auditor walked through your door tomorrow and asked for 5 random charts, Would they be defensible? Are you truly audit ready right now? And the damage doesn't just stop with that one-time recoupment. It creates ripples. Bad documentation leads to lower scores in value-based purchasing, which directly cuts your future reimbursement rates. And if you don't fix the root problems, you're just stuck in this state of ongoing revenue leakage, where the same little mistakes cost you money month after month. Okay, so we've laid out the problem, and it's a big one. But the good news is these risks are totally manageable. The solution is really about shifting from a reactive, manual process to a proactive, automated defense. So here's how that digital shield actually works. First, it catches errors in real time as they're happening. Second, it actively supports your clinicians, guiding them to create notes that are naturally compliant. Third, it acts like your own internal auditor, checking everything before a claim ever goes out the door. And finally, it keeps you in a state of continuous audit readiness, so you are never, ever caught off guard. You know, at the end of the day, it all comes back to this. Payment cuts are not inevitable. They are preventable. They happen when the documentation just fails to tell the complete and accurate clinical story of the amazing, skilled care your team provides every single day. So the final question I'll leave you with is this. Right now, inside your facility, is your documentation a financial asset that's actively protecting your revenue, or is it a hidden liability just sitting there waiting to be discovered?